Здравствуйте, ma'am. My name is Paritosh Kumar Karan, Group 302. My topic is Radiologic Diagnostics in Cardiology. The normal X-ray. This is a picture of normal X-ray. Here we can see the paratracheal stripes, ma'am. Here we can see the interlobular artery and the right atrium here. We can also see the aorta, ma'am. Aorta is right here, ma'am. The para-aortic line. We can see the pulmonary trunk, ma'am, and the left ventricles. Uh, Moving on, ma'am. We can also use this for the checking of the lungs and the other borders such as diaphragms and the hearts, ma'am. This is the normal. This is a problematic X-ray. This is X-ray of aortic aneurysm. Here the bulging in the aorta happens, ma'am, which is also known as enlargement. Because of this, there is problem in giving blood to the organs, and we can say there are two types of this aortic aneurysma, mainly the thoracic ones and the abdominal. Uh, and this aneurysma mainly leads to developing of the tear of the inner layer of the aorta, ma'am. And moving on, ischemia of the heart, disease of the X-ray. Here we can see the arrow, ma'am. Here ischemia, it is mainly a enlargement in the ventricles. We can say due to enlargement here, there is less blood supply to the all the organs, and because of that, there is a problems in the whole organs, which is blockage of the vessels. This is the X-ray of the ischemia. This is the X-ray of mitral stenosis. This is X-ray here. In this, we can see here, ma'am, there is the mitral valve. There is in this situation, mitral stenosis. There is problem from the mitral valve, ma'am, to the to the blood go to the organs, which also lead inadequate blood supply to the body, which lead another problems. Uh, Moving on. This is the normal cardiac MRI. We can see MRI here normally. Different angles are present. Moving on. These are the MRI of mitral stenosis. Here we can see, ma'am, the problem in MRI. Here it is a normal MRI of a heart. In this problem, ma'am, as I said it before, there is problem in mitral valve, which lead blood to go to the other body organs insufficiently. So it is written here, mitral insufficiency. We can see here in MRI. Moving on. This is the different angle of the aortic aneurysm on MRI, ma'am. Here the in aorta there is bulging or enlargement. Here we can see on MRI, ma'am, there is bulge or tubercle form of infusions. Here we can see the bulging process in different photos, ma'am, A, B, and C. This is the MRI of ischemic heart, ma'am. There are different names. The short axis sinuses, the perfusion, and we can see in ischemia, ma'am, there is less supply of the blood to different organs. Because of that, ma'am, there's mainly the causes are the blockage of the vessels where the supply of the blood, and it's mainly not getting enough blood or oxygen. They are also called as the coronary heart disease, ma'am, CHD. They are mainly, although narrowing, they can be caused by different problems, ma'am, such as blood clot or by constriction of blood vessels. Here we can see different angles, ma'am. This is the thrombosis of the right heart on an MRI, ma'am. Thrombosis mainly causes blood clot, where the blood from the heart goes to the organs are very difficult. We can see here, ma'am. There is ultrasound. This is the normal ultrasound, ma'am. As we see, there is right ventricle, left ventricle, right auricle, left auricles. Here, the point of care is there, ma'am. The ultrasound of mitral stenosis, ma'am. As we see here, the mitral valve, there is some problem in opening it properly, which causes less blood flow to the different organs, which ultimately leads to the blood inadequate oxygen inadequate performance. Here, the right thrombosis, ma'am. Ultrasound. Here we can see the thrombus in the right ventricle. This is uh, ultrasound of right heart thrombus. Here, the ultrasound of aortic aneurysm. Here we can see, ma'am, the enlargement of aorta in ultrasound. As I speak it earlier, there is problem in blood supply to the organs. Here you can see the ischemia of ultrasound, ma'am, and there are different arrows showing there is some problem in hearts, which is enlargement and which causes less pressure, ma'am, less pressure of the ventricle, which ultimately leads to the less supply of the blood. That's all, ma'am. Thank you for your attention.